You're listening to Seniors Junction podcast. We're preventing seniors isolation one conversation at a time. I'm your host today, Paul Merkley, and with me is my very special guest, Laura Belazis from Meals on Wheels. Welcome, Laura.
Thanks, Paul. So happy to be here.
Thank you. Could you tell us a little bit about yourself? And Meals on Wheels is very well known, of course, but maybe you could still tell us a bit about what you do.
Absolutely. So my name is Laura Belazis. I serve as the Senior Director of Strategy and Impact at Meals on Wheels America, and I lead the socialization and in-home safety portfolios in the organization. My background is in public health, really focused on the social determinants of health and on program evaluation principles that help us build strong programs and learn from our work. One of my first exposures to senior isolation was earlier in my career as Associate Director of the Campus Kitchens Project, where I worked with student leaders all across the country who were delivering meals and social services. Several of our university chapters were operating University of Georgia's Lunch Buddy program, which paired college students and seniors for a meal and companionship. I was really struck by the positive effects of the program. The seniors felt healthier and less isolated, and the students felt a really strong connection as well. As I've continued in my career, I was excited to have the opportunity to continue this work at Meals on Wheels America. And to tell you a little bit about Meals on Wheels America, we are the leadership organization that is supporting more than 5,000 community-based programs across the US that are dedicated to addressing senior isolation and hunger. Our network serves virtually every community in America, and along with staff and a vast array of volunteers, delivers nutritious meals, friendly visits, safety checks that enable America's seniors to live nourished lives with independence and dignity. We provide funding, leadership, education, research, and advocacy support to empower our local member programs to strengthen their communities, one senior at a time.
One senior at a time, thank you. Well, so since you've done so much work and the premise has to do also with social determinants of health, I imagine you have a fairly sharply pointed idea about the risks of social isolation in the senior population.
Absolutely. Social isolation and loneliness are public health crises, have serious negative health and well-being consequences that impact millions of older adults. We know that 1 in 4 seniors lives alone, 1 in 4 is lonely, and this increases their risk of harmful health issues that could impede their ability to stay in their homes and out of institutional settings. Many of the factors that make older adults more susceptible to social isolation and loneliness, like living alone or having past experiences with falls, are really common among individuals receiving Meals on Wheels. In fact, for many housebound Meals on Wheels recipients, the person delivering their meal may be the only person that they see that day or even that week.
Yeah. And 1/4 socially isolated, 1/4 lonely, and they aren't necessarily exactly the same people, are they?
That's correct.
Mm-hmm. It's very interesting. Well,
and that's also because social isolation and loneliness are not the same thing, and that your quantifiable isolation may not be reflected in your own personal perception of loneliness.
Yes. Okay, we've heard that from other guests too. That's good. Aside from what you've just said, is there more you'd like to add about your vision for tackling the problem of social isolation?
Absolutely. Social isolation is a complex issue. It needs to be addressed by a variety of people across the clinical and social service spectrum. Our work at Meals on Wheels is a key part of this matrix, and we're able to reach a unique, often forgotten population, homebound older adults. The strategy that we're most known for is our home delivered meals. Since our inception, Meals on Wheels programs have harnessed the power of a knock to provide older adults with a nutritious meal, a brief friendly visit, a home safety check, and connections to other needed community-based services. And those services are powerful. They're leading to improvements in anxiety, self-rated health, isolation, and loneliness. They also act as a powerful preventative measure against future costly deterioration of health and well-being. And as we all continue to better understand physical and mental health risks linked to loneliness and social isolation, we recognize that community-based Meals on Wheels programs are an integral part of the solution to combating these growing and costly public health issues. More and more local Meals on Wheels programs have been focusing on ways to supplement the social interactions that occur during our regular meal deliveries. Some of these strategies are friendly visitor programs, pet programs, telephone visits and reassurance calls, household chore assistance, and many others. Many Meals on Wheels programs have more recently been exploring how to use technology to help foster meaningful connections, particularly in light of COVID-19. And at Meals on Wheels America, on the national side, we've been investing in a number of partnerships, research, and pilot efforts to further explore social isolation and loneliness interventions. And we're committed to further growing this work and exploring evidence-informed solutions to better address the changing nutrition and social needs of our clients. For example, we know that pets can mitigate feelings of loneliness, depression, and social isolation, and improve the physical health of older adults. Meals on Wheels has long supported older adults' ability to keep their pets as part of healthy aging. And we recently conducted research into the needs of pet-owning Meals on Wheels clients. Among other results, we found that clients were very strongly bonded to their pets, and 80% believed that the support of their Meals on Wheels program had made it possible for them to keep their pet.
That's very interesting. Do you work with metrics for things like anxiety?
Each of our programs has their own set of metrics, so it depends on the specific program. And then we also work with them on some of our programmatic efforts to help standardize some of those data collection principles.
Okay, that's impressive. So what would you say would be the challenges and opportunities in what you do?
I mean, while Meals on Wheels programs play a key role in addressing senior isolation and loneliness, we're part of a broader, complex landscape of social service providers. Some clients need more than we can or should provide. For example, clinical solutions for depression and other mental health challenges. But our fragmented care system can make it difficult to ensure that the loop is closed on referrals, and it limits data sharing between community-based organizations and healthcare providers. And these disconnects can further contribute to social isolation and loneliness. Now, as an added challenge in many of our communities, critical referral partners just don't exist, such as in rural or medically underserved areas. Another type of challenge is scalability, in part because it can be difficult to secure the volunteers to participate in some of the more time-intensive interventions, like friendly visiting that last over the longer term. But while there are challenges, I think it's really important to highlight that there are also tremendous opportunities. Fostering human connection, collaboration, and partnership are really critical at the national level through Meals on Wheels America, and at the local level through local Meals on Wheels programs. We have found a number of opportunities to collaborate and partner to address some of the gaps and challenges faced by older adults in need of social connection. And we've seen great promise in reducing social isolation and loneliness through both system level and person-centered methods. Senior isolation was already a silent and growing epidemic before COVID-19, but it's grown far worse since. With the onset of the pandemic, scores of additional seniors became at risk of social isolation in a relatively short amount of time and turned to Meals on Wheels to provide services, including essential socialization and companionship. Throughout this challenging time, Meals on Wheels programs really rose to the occasion through a variety of creative, resourceful ways to meet the growing needs of their communities, such as implementing visual and verbal check-ins, augmented phone calls, and handwritten cards to ensure that homebound older adults knew someone cared about their well-being and was checking in on them. The pandemic has brought a new wave of awareness of the impacts of social isolation and loneliness, and many more individuals, young and old, now have firsthand experience with the issues amid COVID-19 health and safety restrictions. This has presented a unique opportunity for Meals on Wheels programs to enhance and advance their service offerings to meet the social connection needs of their clients.
Do you have any thoughts, could I ask, about intergenerational aspects? I imagine many of your volunteers also are seniors, but probably not all of them. Do you find it advantageous to have contact between seniors and younger people?
Absolutely, and I think there's a great kind of literature and evidence base around intergenerational programs, and there are whole organizations and national groups that are focused on fostering those opportunities. I think there are a lot of really promising best practices in that area, and certainly shows up in a lot of local Meals on Wheels programs.
Okay. What advice do you have for our company?
Well, first and foremost, I would say to any organization in this space, don't reinvent the wheel. There are so many individuals and organizations already doing incredible work in the social connection space. I would encourage anyone to reach out to them to connect, to learn more and explore potential partnerships. With the increase in recognition for this issue during the pandemic, we've seen a lot of increased interest in addressing social isolation. But we've also seen a lot of duplicated efforts, which is not a great use of anyone's resources. But second, I would also say, make sure you're building your work based on evidence-based programs and matching them to individual needs. There are a lot of great program models that have been tested to show their effectiveness. And it's also important to consider that one individual's experience with social isolation and loneliness is not the same as someone else's. It's really important to use validated screening tools and better understand what's affecting someone's personal experience with social isolation and loneliness. So you make sure you can offer them the right type of program to meet their individual needs. And then by expanding on promising best practices and partnering with others in the field to address social isolation and loneliness now, we're all better equipped to prevent future poor health outcomes among older adults and promote healthy aging. Together, all of our work at the local, national, and international levels can build healthier and more socially connected communities.
So if someone wants to reach out for you, and I imagine in many cases, it's not going to be a senior, but maybe a caregiver or a family member or different people like that. How do they get in touch with Meals on Wheels?
Absolutely. So you can always check out our website, which also includes our research efforts at mealsonwheelsamerica.org. You can also find Meals on Wheels America on Facebook or Instagram, or follow us on Twitter at _Meals on Wheels.
Okay, thank you very much.
Thank you, Paula. It was a delight to speak with you.